Okay, thank you. Thanks, Liz. All right, let's get underway, shall we? It's 12:30. Hello, everyone, and welcome to today's webinar on the power of consumer engagement during this time of real change for the aged care sector. My name's Andrea. I'm Research and Education Coordinator at CDA Queensland and also Consumer Engagement Advisor for Aged Care. So first of all, I would like to acknowledge the traditional owners of the lands on which we're all meeting today and pay our respects to any elders who might be with us today and to elders past, present and emerging. So today, I want to briefly talk about who we are as CDA Queensland, how we fit into the scheme of things. I want to talk a little bit about what engagement is and why we need to be talking about it now. Now, we've got a fairly broad group today. There's quite a big group of people registered, really broad range of organisations and roles. So we've tried to include something for everyone in here, some frontline delivery right up to governance. And I want to especially thank everybody for their contributions. We've spoken to quite a few people over the last couple of months about the things that they'd like us to talk about today. We haven't been able to cover everything in today's session. It's short, only half an hour, but we're hoping this will be just the start of a conversation. Just briefly, CDA Queensland, or Council on the Ageing Queensland, we're a for-purpose charity and we're about advancing the rights, needs, interests and futures of all of us as we age. So CDA provides a connection point for older people, their families and communities, their organisations, governments at all levels to address the issues that impact us and to co-create change. So we're a member of the CDA Federation and we've got people joining us today from in different states, and I'm sure you'll be familiar with the CDA in your state or territory. The CDA Federation is comprised of all the state and territory CDA organisations and CDA Australia. And what we do is, as a federation, work together to make sure that the experience of ageing in Australia is filled with possibilities and opportunity, and that people have influence on the things that impact them and their communities. Now, our work on consumer engagement here at CDA Queensland has been very practical work towards supporting engagement in the sector, including workshops and resources. And I'll talk a little bit more about those resources later on. But we also offer services for providers who are interested in building their capability, developing their strategy, encouraging innovation in consumer engagement in their organisations, working at every level and every part of organisations. Now, one of the key things in talking about engagement is having a shared idea about what we're talking about. And I want to focus on this for a little bit at first because we have such a diverse group with us. So when you hear me say consumer engagement in aged care, I'd like to know what comes to your mind. And I'd like you just to pop into the chat. What is it that comes into your mind when you hear consumer engagement in aged care? Does everybody have access to the chat there? Focus groups, yeah. Partnership. Thought everybody might be too busy eating their lunch to type into the chat. Resident and family involvement at all levels. Two-way conversations, quality standards, yeah. Person-centered care, collaboration and partnerships. Listening to people in groups and on phone, not just online. Consultation and representation in planning stages. And choice. Excellent. Thank you. Thank you so much for all those contributions. And so all of those things for us relate to engagement. So when we talk about consumer engagement, we're talking about all of the ways that you interact, communicate with, involve, partner with consumers and stakeholders. So I'll just talk a little bit about what that really broad scope looks like. So engagement is about involving people, consumers, families, carers, in all aspects of care. So that means engaging people in discussions and decisions about their own individual care and lives, as well as discussion and decisions at the service or organisational level, like service planning and delivery, setting priorities, identifying improvements to care and services, measuring and evaluating services, broad aspects of organisational governance. So consumers could have a role in any part of your service or organisation and, in fact, beyond. And for some providers, that's included things like supporting consumers to engage directly with their local member around the aged care reforms, or with federal government consultations about the aged care system. So supporting consumers to directly engage with the system about the reforms. And at any of those levels of influence, engagement can occur at different depths. And most of you will be familiar with this if you've seen the IAP2 spectrum or other engagement models from health or community development. So it can be anything from how we interact with people to build relationships, how we share information, which, for example, could be commonly newsletter, website, email alerts, communications. Asking for people's feedback or input, consulting them on a proposal, two-way discussions about issues, or going beyond that to making decisions in partnership, which is where we would find true co-design, where consumers and providers are working together to collaboratively make decisions or design solutions. And then supporting people to take the lead on an issue or a decision or a project. Now, within that scope, engagement could involve just one person or a group of people or a community. And that community could be your whole organisation or a community of identity or of geography. So when we talk about engagement, we're talking about everything in that broad scope. So there are a lot of benefits to consumer engagement and a lot of reasons to care about it. First of all, and significantly, it is essential to upholding the rights of people receiving care, to be involved in all decisions that impact them, to have their wishes and needs respected, to be informed and to be heard. It also supports you in making sure that services are appropriate, are inclusive, are responsive to the individual, but also to the community and to the sector, and particularly in this climate of change that we're in. It's essential to making sure and continually developing the quality of care and safety of your services and the outcomes of your services. It forms part of care standards and requirements. It helps you to adapt and to innovate, to make better informed decisions, not just about people's individual care, but better decisions for your business and your strategic development in your business. Now, if you don't engage well, where might you be at risk? Maybe increasing complaints, escalation of complaints, reputational damage in the market, not being able to compete with other providers in the market, perhaps not meeting accreditation requirements, risks to care quality and safety, not being able to properly uphold consumers' rights, or potentially even your organisation's own values, not being able to adapt to changing consumer needs and preferences within your organisation or within the market more broadly. You can miss really valuable opportunities to enhance your operations. You might end up with programs or systems or processes that get poor uptake that people aren't interested in. You might get staff becoming frustrated and disengaged. Now, we know from quality data and from our own conversations with consumers and their families that some of the areas where we see issues include areas particularly related to engagement. Things like addressing the needs and goals and preferences of individuals, management of risks. And of course, we know that requirements around risk and the way that risk is managed from a compliance point of view can be challenging. Consultation and communication, including representative communication, management of complaints and feedback. Now, we've seen and heard both good and poor practice in engagement across the sector, and I've spoken with quite a number of staff in different organisations and roles over the years who feel frustrated about the practice they see around them and are looking for ways to influence change. Now, before the pandemic, we already knew one of the key issues staff reported as impacting their engagement with consumers was feeling time poor, understaffed, under pressure. People have told us they feel restricted from providing the quality and tailored care they want to provide, from meeting consumers' communication and information needs, from connecting and engaging with consumers the way they want to because of the staffing and resourcing issues in their organisations, funding models, reporting requirements, all things that kind of join together. But another issue is knowledge and understanding. People are just kind of expected to instinctively understand engagement, to know how to engage well, but they're rarely trained or supported in doing that. And in some organisations, we see consumers advising, helping provide direction across really diverse areas of the business: HR, finance, communications, policies and procedures, IT. But often, even when staff in direct care delivery have a good understanding about engagement, staff outside of direct care delivery can have a limited understanding about what engagement is, their role in engagement, its value to their work. So consumer roles can become more limited to what are seen as care issues. And the problem with that is that everything the business does ultimately impacts the consumer. So every business unit needs to understand the consumer. So I want to pose a question to you while you're listening today, to have a think about what it might mean to your organisation to take a deeper look at your engagement. Now, we've heard a lot from providers and consumers about the management of COVID and natural disasters in aged care, both positive and negative. We've heard a number of stories from the community that have been concerning, obviously, about providers having poor communication with consumers and families, not consulting them about decisions, people feeling they're not being listened to, being concerned about the well-being and outcomes for people receiving care. But we've also spoken with providers who've used their relationships with consumers and families to find opportunities to work with them during the pandemic and to involve them in decision-making. And I want to share with you a few examples that illustrate some principles or learnings out of the last couple of years. And some of these are fairly specific to their context. They might not directly translate to your organisation, but I want to use them to emphasise some important lessons that we've seen. Now, the first is about how consumer roles have been valued and supported. So one example here is one provider we spoke to has consumer advisory groups, but found it difficult to engage those groups because they weren't skilled or comfortable with virtual meetings previously. So what the provider did was invested time and resources in lower tech and telephone engagement to make sure that those consumers, those groups, were able to continue their important work in advising the organisation. Now, that's not a long-term solution. Obviously, there are some limitations compared with having a group being able to meet in person. But what it shows is the commitment to the critical roles of those consumer advisors in the business. It couldn't simply stop because they became more difficult to support. The second point I want to raise is about how you can actively partner with consumers to create solutions. So one community provider had trained and supported some of their clients previously in using tablet devices. And then during COVID, they were able to involve that group when that group couldn't be running their program face-to-face. They involved that group in co-designing a virtual program that everybody was happy with. One provider put a focus on not just looking at their outbreak management obligations and what they were being recommended and required to do, but partnering with consumers and their families in coming up with risk management strategies that could also support consumers' wellbeing and visitor access. So these are examples of how you can leverage what you have available to work in partnership in your responses, rather than just coming up with solutions for consumers. The third is the critical importance of strong existing relationships and lines of communication. So some providers had tense and challenging times with consumers and families while they were trying to navigate communication and requirements during COVID and during emergencies. I saw from one provider that they found consumers and their families to be a huge support and resource during the pandemic, moral support and practical support. And that kind of outcome is reflective of a strong, positive and mutually supportive relationship, not just a transactional one between consumers and providers. Now, some providers did find it difficult to get local informational support to know who to send people to during emergencies. But there was also some amazing coordination and collaboration with government services among networks of providers, organisations, businesses, individuals to ensure continued support during the floods. And what that highlights is the relationships that people have, not only with consumers and their families and carers, which are, of course, absolutely critical, but with community networks, other care and community services, state and local government services, community organisations that provide information and support and pathways for referral. And finally, I want to highlight the issue of inclusion when we adapt our processes. So engagement has changed and adapted for everybody during the pandemic, us included. And there's been some reliance by both government and providers on people being digitally literate, to evidence vaccination, to book visits, to enter care homes, to provide support or to visit, to connect when they couldn't be there in person, to engage with their provider, to access health information for telehealth. And while that works for a lot of people, there are a lot of people it won't work for. Not everybody has the skills, the knowledge, the resources, access to be able to do that. So one of the learnings has been how some of those solutions we've all relied on so heavily aren't always inclusive. Now, most providers tell us they've really stepped up their communication by phone, reaching out, trying to ensure they kept close contact with people. One thing that people really highlighted was that engagement by phone is a stopgap, but it's not ideal because that in-person interaction is really vital in effective communication. So providers have also really emphasised the importance of staff on the ground and out in the community as their eyes and ears. And that's always important, absolutely critical part of your engagement strategy and process. But it has been both especially critical and especially difficult during the pandemic, when not all your services were being delivered, and it might not have been the usual staff or in fact even your own internal organisational staff who were delivering the services. So effective engagement is an opportunity for us to manage risks, to find solutions, to open new spaces for communication. And consumers and their families and communities are a really significant resource and support if they're involved in a meaningful way. The pandemic is that kind of situation, fast-moving, high-pressure situation that shows us where there's room to work differently. And if there are gaps in knowledge or skills or processes in your organisation, if there are gaps in commitment to the role of consumers, capacity to involve them meaningfully, ability to adapt how you involve them, then you'll be seeing those impacts now. And now is the time to capture those learnings. So we would really encourage you to take this opportunity now to look at how consumers and families and carers have been involved in your outbreak and other emergency responses, how you can now learn from them and involve them in reviewing and developing those responses and plans for future emergencies. Now, this is, of course, not the only big issue that the sector is dealing with at the moment. Changes are pushing ahead. There's a lot to be across to incorporate into strategy and operations. Now, these are some of the opportunities I've been talking with providers about recently, and I want to talk through a couple of these with you. So a number of providers are using the opportunity of the reforms to undertake large-scale rethinking and transformation. So that could be changes to whole service models or parts of the business, major restructuring, digital transformation, for example. And even on a smaller scale, providers are looking at new systems, new technologies to streamline, be more efficient, support care. And we often find that those large-scale transformations and shifts don't actually involve staff or consumers, families or carers in a really meaningful way. But those are the people who should be at the centre of that thinking and decision making. Or you can easily end up with solutions or models that people won't buy into. Similarly, providers have shared with us some of their strategic planning approaches. Some are undertaking or about to undertake strategic planning at this moment. We sometimes find that even providers with good engagement processes cannot effectively use them in the strategic planning process. And what they're missing is the opportunity to ensure that the guiding decisions about the organisation, the future directions, the major priorities of the whole business are centred around and informed by the people the business exists to serve. Providers have also been sharing with us workforce strategies they've used during the pandemic in particular, but also across the sector. People are looking at their workforce strategies on a larger scale. So some providers already include consumers in recruitment processes, but have you considered how consumers and families, as well as staff, can be actively involved in developing your workforce strategy more broadly, including strategies for retention and for development? And a number of providers are, of course, looking at the roles of consumers broadly in governance structures in their organisations. And a couple of points about this. Often we see lots of processes and mechanisms at play in organisations, but without any real framework that draws them together. So they're not being used to best effect, or in some cases, some of the mechanisms aren't really being used at all in the organisation. The second point is that the ways you involve consumers and ensure their voices are heard in your governance needs to be planned around consumers, not just around what works for your organisation and what meets requirements. So my question is, what do you know about how consumers in your organisation want to engage and what support they need to engage effectively? So these opportunities are examples of looking at everything your organisation does and asking how consumers and families and carers are involved, how their voices are heard. But it doesn't need to be overwhelming. It can be just about taking something you're already working on, a process you've been doing for years, looking at ways to use those differently to open more roles for consumers, widen opportunities for influence out to other stakeholders, to give those who are involved greater influence. So every task or project in the organisation is an opportunity to build knowledge, to explore new potential for consumer roles. And in fact, embedding this within your activities and projects, rather than seeing it as a separate project, will help you not only create a working model and framework that's meaningful to your organisation, but it helps to embed and reinforce the change. So I want to ask you now to, again, share in the chat. I'm interested to hear from you. What's on your agenda? What do you think your major opportunities are in terms of consumer roles? Has this sparked something for you? Are you already doing some of what I'm talking about? So I'd love to hear about what you're doing and how it's going. Please feel free if you want to share anything in the chat. To see if someone has something they want to share. Everybody might be busy eating their lunch. Has this sparked anything for anyone? Any ideas? Anything you're working on that you think you could look again? Oh, Sula, Coda Taz is working with the Commission. Is that Sula? Feedback and complaints with consumers and providers. Yeah, brilliant. And recruitment is one area that could be looked at. Yeah, absolutely. And there are providers who are really involving consumers in recruitment processes, but there's always more that can be looked at. And we'd like to hear if people are involving consumers in recruitment processes, what you're doing and how it's working, and how we can share that with others as well. Aged Care Quality Standard 6, yes, Sula, yes. So CODA is working on some things around feedback and complaints in Quality Standard 6. Andrew, we're looking right now at how to align consumer engagement with our overall business strategy. Brilliant. Exactly the kind of big picture stuff that needs to be happening. Seeing feedback as an opportunity. Resuming our consumer reference group to inform our improvement process. Excellent. That's brilliant. We'd love to hear how all of that's going. I'd love if you would keep in touch and let us know how all that's working for you. Thinking about finance, working with consumers on how we present financial information. Yeah, absolutely. Yeah, that's a big one. And billing and invoicing and understanding fees and charges and all of that kind of stuff. Yeah, excellent. Brilliant. Thank you for that. And please keep them coming. We really want to keep this conversation going. So if you're looking for help on any of this, there are some tools and resources that can help you with consumer engagement. Now, a special note, we're working on reviewing our own resources, which we published with the Commission a few years ago and now need a bit of an update. And a shout out to April from the Commission, who's joining us today and who's working on those resources with us. So the resources are a series of tools to help you think through what engagement looks like and how you want to approach it. So we'd like to invite you to help us look at those, test them out, let us know what's most useful for you, if there's something missing from that for you. So if you're interested in being part of that, please do get in touch with us and we can send you those. We can also help to facilitate consumer engagement development and support you, your staff, your consumers at any stage of the process. So that could be building yours or others' understanding about what consumer engagement is, working with you on your vision of what engagement looks like for your organisation, for the consumer, reviewing, assessing your processes or your approaches, strategizing, planning engagement, and building or creating new approaches, improved approaches. Now, one thing I wanted to ask you is, for our next session, would it be useful for us to do a session and perhaps more of an in-depth workshop on a process of working through to do that? So if that would be useful for you, if there's something else you'd particularly like us to cover, please do let us know. Yes, this will be recorded. Sorry, Sula. This is one of the challenges of the doing things online, isn't it? Yes, this has been recorded and we will be sending you the recording for you to listen to. Yes to a workshop from Sula. Excellent. Thank you. Please do let us know if there are particular things you'd like us to be looking at, to be talking about. If there are things you want to workshop in depth, get in touch and let us know so that we can be adding the most value we can to you guys. So thank you all. Please get in touch. Let us know what worked well and didn't work well today, how we can make our webinars and our coming workshops really valuable for you. We would love to hear how things are going for you, what you've got on the agenda, what you're excited about in terms of consumer roles. We're very excited to keep in touch. So thank you.